Modern medicine is pretty cool, right? You go to the doctor, they diagnose you with actual science, prescribe medication that works, and you get better. Simple, effective, based on centuries of research and understanding of how the human body functions. But here's the thing. For most of human history, doctors had absolutely no freaking clue what they were doing. And I mean none. We're talking about medical professionals who thought drilling holes in your skull would cure headaches, that bloodletting was the answer to literally everything, and that shoving mercury up your ass was a legitimate treatment, and people paid them, with money, to do this. The truly terrifying part. These weren't random witch doctors operating out of caves. These were respected physicians, trained at prestigious medical schools, who genuinely believed they were helping people. They had degrees. They had credentials. They had detailed medical theories that explained why their treatments worked. The theories were completely wrong, but they sounded scientific enough that people believed them. And as a result, millions of people died from treatments that were supposed to cure them. Medical history isn't just bizarre. It's a graveyard of horrible ideas that somehow became standard practice. But before we dive into this nightmare of medical malpractice and institutional insanity, if you enjoy learning about how humanity spent centuries confidently doing the absolute wrong thing, hit that subscribe button, leave a like if you're grateful for antibiotics and anesthesia, and comment below which of these medical practices sounds the most insane to you. Choose your preferred method of accidental suicide. Now let's get into the madness. Let's start with bloodletting, which was the aspirin of ancient and medieval medicine. Got a fever? Bloodletting. Broken bone? Bloodletting. Headache? Bloodletting. Depression? Believe it or not, bloodletting. It was the go-to treatment for basically every medical condition imaginable, and it remained popular for over 2,000 years. Yes, 2,000 years of doctors systematically draining blood from sick people who needed, their blood to survive. The theory behind bloodletting came from the ancient Greek physician Hippocrates and his concept of the four humors: blood, phlegm, yellow bile, and black bile. According to this theory, illness was caused by an imbalance of these humors in the body. Too much blood? You're sick. The solution? Remove some blood to restore balance. Simple. Logical. Completely fucking wrong. But it gets worse. Bloodletting wasn't just a little pinprick on your finger. We're talking about slicing open veins and draining pints of blood from already sick and weakened patients. Doctors would use lancets, which were basically fancy knives, to open veins in the arms, legs, or sometimes the neck. They'd let the blood pour into bowls until they decided you'd lost enough. How did they know when to stop? Vibes mostly. When you looked like you were about to pass out, they figured that was probably enough. And if knives weren't your thing, there was always leeching. Yes, actual leeches. Doctors would place medicinal leeches on patients' skin and let them suck blood for hours. The leeches were specially bred for this purpose and were considered a sophisticated medical tool. Some physicians would use dozens of leeches at once, covering the patient's body in blood-sucking worms. The leeches would gorge themselves, swell up to several times their normal size, and then either fall off or be removed. And then the doctor would probably charge you extra for the premium leech treatment. The practice was so widespread that leech suppliers became a legitimate profession. There were entire businesses dedicated to farming and selling medicinal leeches. In the 1800s, France imported over 40 million leeches annually for medical purposes. 40 million. That's how committed they were to this absolutely insane practice. Now you might be wondering, did bloodletting ever actually work? Technically, in very specific rare cases involving conditions like hemochromatosis or polycythemia, removing blood can be beneficial. But those conditions are extremely rare. For the vast majority of patients, bloodletting did nothing but weaken them further. And for many, it was fatal. The most famous victim of bloodletting was probably George Washington. In December 1799, Washington developed a throat infection. His doctors, being highly trained professionals, decided the best course of action was to drain his blood, multiple times. Over the course of about 12 hours, they removed approximately 40% of his total blood volume. That's roughly 80 ounces, or about half a gallon of blood, taken from a 67-year-old man with a severe infection. Washington died. Obviously, modern medical analysis suggests he probably had acute epiglottitis, which is treatable with antibiotics. Instead, he was bled to death by doctors who genuinely thought they were helping. His last words were reportedly, "'Tis well," which honestly, under the circumstances, is pretty effing metal. Bloodletting persisted well into the 19th century and wasn't fully abandoned until the 1920s, when medical science finally caught up with the fact that draining blood from sick people is, in fact, bad. 2,000 years. It took humanity 2,000 years to figure out that making sick people lose massive amounts of blood doesn't help them get better. Let that sink in. But bloodletting at least had the decency to be relatively straightforward. Stick knife in vein, drain blood, hope for the best. Our next medical practice involves a bit more creativity and a lot more insanity. Trepanation is the practice of drilling or scraping holes into the human skull while the patient is still alive. And before you ask, no, this wasn't some barbaric practice from the Stone Age that was quickly abandoned. Trepanation has been performed for over 7,000 years and continued well into the modern era. Archaeological evidence shows that ancient civilizations across the world, from Peru to China to Europe, were enthusiastically boring holes into people's heads. But here's the really crazy part. Many patients survived. Analysis of ancient skulls with trepanation holes shows evidence of bone healing, which means the person lived long enough after the procedure for the bone to start growing back. Some skulls show multiple trepanation holes, suggesting that people came back for repeat procedures. Imagine that. You survive having a hole drilled in your skull, and your thought is, you know what, let's do that again. So why were ancient surgeons drilling holes in heads? The reasons varied depending on the culture and time period, but they generally fell into a few categories. First, there was the practical medical reason: relieving pressure from skull fractures or brain injuries. This actually makes sense. If someone gets hit on the head and develops swelling or bleeding in the brain, removing a piece of skull can relieve pressure and potentially save their life. Modern medicine still does this with a procedure called decompressive craniectomy. But then there were the less scientifically sound reasons. Many cultures believed that mental illness, epilepsy, migraines, and other neurological conditions were caused by evil spirits or demons trapped inside the skull. The solution: drill a hole to let the demons out. Yes, really. They thought they could release evil spirits through a hole in the skull like you're venting a pressure cooker. The procedure itself was exactly as horrific as you're imagining. In ancient times, surgeons would use sharpened stones, shells, or metal tools to slowly scrape away layers of the skull. Later, they developed specialized drills and saws. The patient was usually conscious because anesthesia didn't exist yet. At best, they might give you some alcohol or opium to dull the pain, but mostly you just had to sit there and feel someone drilling through your skull. The infection risk was astronomical. You're creating an open wound directly into the brain cavity with unsterilized tools in environments with no concept of germ theory. The fact that anyone survived is honestly miraculous and speaks to the human body's incredible resilience. Many patients died from infection, bleeding, or brain damage. But enough survived that doctors kept doing it. During the Middle Ages and Renaissance, trepanation became more sophisticated but no less insane. Surgeons developed specialized trepanning tools that looked like corkscrews with handles. They'd position the drill against the skull and twist, gradually boring through the bone. Some surgeons would create small holes and then use a saw to connect them, removing an entire section of skull. The bone piece would sometimes be kept as a souvenir or even made into jewelry, because nothing says fashion like wearing part of someone's skull. One particularly enthusiastic trepanation advocate was a 16th century French surgeon named Jacques Guillemot, who wrote detailed instructions on how to perform the procedure. He recommended trepanation for headaches, epilepsy, madness, and even stupidity. Yes, he genuinely believed you could cure stupidity by drilling a hole in someone's head. Spoiler alert, it doesn't work. The practice continued in various forms into the 19th century, and believe it or not, still has some modern advocates. There's a small community of people who believe in the benefits of self-trepanation, claiming it increases blood flow to the brain and enhances consciousness. These people are, to put it medically, completely out of their F-box shucksing minds. Do not drill holes in your head. I shouldn't have to say this, but apparently I do. So we've covered draining your blood and drilling your skull. Surely medical history can't get more bizarre than that, right? Wrong. So very wrong. Mercury is one of the most toxic substances known to humanity. It causes severe neurological damage, kidney failure, respiratory problems, and death. It is the kind of thing you definitely do not want inside your body under any circumstances. So naturally, doctors used it as medicine for centuries. Mercury-based treatments were incredibly common from ancient times through the early 20th century. The ancient Chinese used mercury compounds in supposed elixirs of immortality, which ironically guaranteed you'd die faster. Roman and Greek physicians prescribed mercury for various ailments. And during the Renaissance and Victorian era, mercury became the go-to treatment for one particular condition: syphilis. Syphilis appeared in Europe around the late 1400s and quickly became a massive epidemic. It was sexually transmitted, highly contagious, and, in its advanced stages, absolutely devastating. The disease progresses through multiple stages, starting with sores, then rashes, then attacking internal organs in the nervous system, eventually causing insanity, paralysis, and death. It was terrifying, and doctors had no idea how to treat it. Enter mercury. For reasons that made sense to nobody but seemed to work in some superficial way, mercury treatments appeared to reduce some syphilis symptoms. The most common form was mercury ointment, which patients would rub on their skin. The mercury would be absorbed into the body and would apparently reduce the visible sores and rashes associated with syphilis. Doctors saw this and declared success, completely ignoring the fact that they were slowly poisoning their patients to death. But topical ointments were just the beginning. Some doctors prescribed oral mercury, having patients swallow mercury compounds. Others used mercury vapor treatments, where patients would be placed in sealed chambers and forced to inhale mercury fumes. And then there was the truly special method: mercury fumigation of the rectum. Yes, they would literally blow mercury smoke up your ass. This was considered cutting-edge medical treatment. The side effects of mercury poisoning were horrific and obvious. Patients would develop something called mercury mouth, where their gums would rot, their teeth would fall out, and they'd produce copious amounts of saliva. Some patients would produce up to 2 liters of saliva per day. They'd also experience tremors, memory loss, kidney damage, and neurological problems. But doctors saw the excessive salivation and thought, great, the body is purging the disease. In reality, the body was desperately trying to expel the poison that was killing it. The truly insane part is that mercury treatments continued even as the side effects became impossible to ignore. Doctors developed the saying, "A night with Venus, a lifetime with Mercury," referring to how syphilis from a sexual encounter would lead to a lifetime of mercury treatments. The treatment was often worse than the disease, but patients had no other options, so they continued subjecting themselves to slow mercury poisoning in the hopes of curing syphilis. Mercury was also used to treat other conditions. Constipation? Here, swallow some mercury. Parasites? Mercury enema. Teething pain in children? Mercury-based teething powders, which killed thousands of infants. Mental illness? Mercury injections. There was basically no medical condition that doctors didn't think could be helped by adding neurotoxic heavy metal to your body. One of the most famous victims of mercury treatment was Abraham Lincoln. While he's better known for other historical contributions, Lincoln suffered from severe depression and was treated with a mercury-containing pill called blue mass. Modern analysis of Lincoln's hair shows elevated mercury levels, suggesting he was experiencing mercury poisoning. Some historians believe the mercury treatments contributed to his reported mood swings and erratic behavior. The practice of using mercury as medicine didn't fully end until the 1940s and 1950s, when antibiotics finally provided effective treatment for syphilis and other bacterial infections. But even into the mid-20th century, some doctors still prescribed mercury-based treatments, demonstrating humanity's incredible ability to ignore overwhelming evidence that something is a terrible idea. Mercury poisoning is bad, but at least it was attempting to treat real diseases, even if the method was catastrophically wrong. Our next practice managed to be both medically useless and socially destructive. The lobotomy is perhaps the most infamous medical procedure in history, and for good reason. It involved literally scrambling a person's brain to treat mental illness. And it was so popular and widely accepted that the doctor who invented it won the Nobel Prize. Yes, the Nobel Prize for scrambling brains. The procedure was invented in 1935 by Portuguese neurologist Antonio Egas Moniz, who theorized that mental illness was caused by fixed neural pathways in the frontal lobes of the brain. His solution? Destroy those pathways. The original procedure involved drilling holes in the skull and injecting ethanol directly into the frontal lobes to destroy brain tissue. Later versions involved inserting a wire loop or leucotomy and sweeping it back and forth to sever connections. But the procedure that became most famous and widely used was the transorbital lobotomy, developed by American physician Walter Freeman in 1945. Freeman's innovation was making lobotomies quick and easy. Instead of drilling through the skull, which required an operating room and a neurosurgeon, Freeman's method involved inserting an ice pick-like instrument through the eye socket, above the eyeball, and into the frontal lobe. Then you'd wiggle it around to destroy brain tissue. The whole procedure took about 10 minutes and could be performed in a doctor's office or even at the patient's home. Freeman literally used an actual ice pick from his kitchen for his first transorbital lobotomies before having custom instruments made. He would knock patients unconscious with electroshock, insert the ice pick through the eye socket, give it a little tap with a hammer to penetrate the orbital bone, and then sweep it side to sever neural connections. Then he'd do the same thing on the other side. Boom. Lobotomized. Freeman was so proud of his technique that he traveled around the United States in a van he called the Lobotomobile, performing lobotomies wherever he went. He lobotomized over 3,000 patients personally and trained other doctors to do the same. He even lobotomized patients in assembly line fashion, performing multiple procedures in a single day. The supposed benefits of lobotomy were that it made patients calmer and more docile, which is technically true. It's also what happens when you destroy someone's frontal lobe, the part of the brain responsible for personality, decision-making, and higher cognitive functions. Lobotomized patients often became emotionally flat, less anxious, and more compliant, but they also lost their personality, motivation, and ability to function independently. Many became essentially zombies, capable of basic functions, but stripped of anything that made them who they were. The side effects were catastrophic. Patients experienced seizures, incontinence, personality changes, and severe cognitive impairment. Some became completely unresponsive. Others developed childlike behavior. Many died from complications, including bleeding and infection. The mortality rate for the procedure was around 5%, meaning 1 in 20 patients died directly from having an ice pick shoved into their brain. But the medical establishment loved lobotomies. They were cheap, quick, and appeared to solve the problem of difficult patients in mental institutions. Between the 1940s and 1960s, over 40,000 lobotomies were performed in the United States alone. Worldwide, the number is estimated to be over 100,000. The procedure was used on a wide range of patients, often for conditions that wouldn't even be considered serious mental illnesses today. Depression, lobotomy. Anxiety, lobotomy. Homosexuality, lobotomy. Rebellious women who didn't conform to social expectations, lobotomy. Children with behavioral problems, lobotomy. It became a catch-all solution for any mental or behavioral issue that doctors or families didn't want to deal with. One of the most famous lobotomy victims was Rosemary Kennedy, sister of President John F. Kennedy. At age 23, she underwent a lobotomy to control her mood swings and rebellious behavior. The procedure left her permanently incapacitated, with the mental capacity of a toddler. She spent the rest of her life institutionalized, unable to care for herself. The practice of lobotomy began to decline in the 1960s and 1970s as antipsychotic medications became available, and the horrific outcomes of the procedure became impossible to ignore. Freeman himself was eventually banned from performing surgery after a patient he lobotomized died from a brain hemorrhage. He performed this fatal procedure on a woman who had undergone 2 previous lobotomies by him. Yes, he lobotomized the same person 3 times. The lobotomy stands as a stark reminder of how medical authority and good intentions can lead to catastrophic harm when combined with poor understanding and lack of oversight. Thousands of people had their brains permanently damaged by a procedure that was not only ineffective but actively destructive, all while doctors congratulated themselves on their innovation. So there you have it, medical practices throughout history that were so bizarre, so misguided, and so catastrophically wrong that they make modern medical mistakes look like minor typos. Draining blood from sick people who needed their blood, drilling holes in skulls to release demons, poisoning patients with mercury and calling it treatment, scrambling brains with ice picks to cure mental illness. The truly terrifying part is that none of these practices were performed by evil people. They were done by doctors who genuinely believed they were helping. They had theories, they had training, they had institutional support. They were just completely, catastrophically wrong, and millions of people died or suffered because of it. This is why the scientific method matters. This is why peer review matters. This is why we test treatments before using them on humans. Because without rigorous scientific standards, medicine becomes a nightmare of well-intentioned torture. So the next time you complain about having to get a shot or take some pills, remember that it could be worse. Much worse. Your doctor could be coming at you with an ice pick, a bag of leeches, and a bottle of mercury, all while insisting it's for your own good. Sweet dreams, and maybe appreciate modern medicine a little more.